Hello and happy World Sight Day 2020 to all of you. I would like to tell you that I'm very excited to be here to be able to share some information with you. My name is Dr. Sandra Block. I am a professor emeritus at the Illinois College of Optometry in Chicago and a global clinical advisor for the Special Olympics Lions Club International Opening Eyes program. The title of my slide is Special Olympics Lions Club's International Opening Eyes, and I'm going to talk about health and intellectual disability with a focus on the vision program that we've created. So over the years, we know that throughout the world, people with intellectual disabilities, or ID, are literally a forgotten population. There has been a gross unmet disparity in terms of their health status and basic protections, as well as the quality of life. The good thing is there has been a lot of interest in changing that or shifting things for this population. And there has been a great deal of literature that has come out in the last 10 to 15 years, really focusing on the disparities that people with ID have existed with. We know that 51% of the population reports their health as poor or fair. We know that this is a population that faces an elevated risk for secondary health problems. One of the ones that's clearly obvious to all of us as we work with this population is it is 5 times more likely that a person with ID would be diabetic versus someone without intellectual disability. We know that this population is often a victim of abuse, both physical and neglect. And interestingly enough, there was a study done in the United Kingdom which proved that people with intellectual disability die 16 years earlier than people without intellectual disability. So is this a problem? Is this a significant problem? Well, the data shows that the scope of the world's population with intellectual disability amounts to over 200 million people. That accounts for about 1 to 3% of the world's population. And the reality is surveillance is so poor in many parts of the world that it may actually be a little higher. Though the definitions of what intellectual disability varies between countries, I think the surveillance could be improved significantly so we have a more accurate idea of what the problem is. What are we talking about when we talk about a person with intellectual disability? Well, we focus on something referred to as adaptive behaviors, and that's broken down to 3 pieces: conceptual skills, social skills, and practical skills. Conceptual skills are those things that relate to language and literacy, money, time, and number concepts. Social skills are a little bit more focused on the interpersonal skills that they would have, including social responsibility, self-esteem, how to problem solve social interactions, and the ability to follow rules. And lastly, those practical issues, such as activities of daily living or personal care, eating by themselves, going to the bathroom, occupational skills, the ability to travel independently, to be able to follow a schedule, routines, and safety. Who are these people? People with intellectual disabilities are our neighbors, our family members, our coworkers in our community. And the fact is, the Special Olympic athletes that we work with are truly fierce competitors and very professional in their sports. They compete, they train, they attend schools, they volunteer, they take leadership roles, they work, and they contribute to the community. So it may be somebody that you work with already and you didn't even realize that they had an intellectual disability. The fact is, there are many barriers to good health, and they fall into one of these 3 big categories. So the first category is the section that I have here in purple, the cultural beliefs, people who have unconscious bias against someone who looks a little bit different. There's lots of stigmas associated with somebody with a particular syndrome or disability, and the attitudes and discrimination are rampant. The other thing that we have to think about is this is a population that has lack of transportation. There's poor enforcement of laws to protect this population. This is a population, both them and their family, that have a higher incidence of poverty levels. And this population rarely advocates for themselves. They're just so used to taking whatever you say as what they have to do. And the other part is the one I'm more concerned about with today's presentation. There's an insufficient amount of provider training in dealing with this population. There's also a limited amount of efforts for prevention and health promotion. We need to do a better job in educating them about how to take good care of themselves so that they can have a higher quality of life. There's also a lack of awareness about the needs of this population and lots of diagnostic overshadowing. It's not uncommon for people with intellectual disabilities to have a problem, go to the emergency room, and instead of looking at them as a whole, just adding another medication to control their behavior, sadly enough. So I'm going to turn now to the Special Olympic Lions Club International Opening Eyes program. And I want to give you an example of an athlete that came through our venue once. She was a 35-year-old individual with intellectual disability, and she reported that she goes every year to her eye doctor. She presented to us as legally blind, and she's never been given a pair of glasses, yet she had a significant refractive error. She couldn't read the chart, and the reason her eye care didn't provide spectacles for her is because they didn't know how to adapt the exam to her capabilities. Instead of looking at her as her disabilities, they were unable to accept her abilities. And I'm going to show you some things that I think are really helpful for you to realize. There are lots of ways that we can assess the vision of an individual who is nonverbal, pre-literate, or illiterate. So clearly, this is what we want for all of our athletes. We want our athletes to be able to see well on the basketball court, to be able to throw the ball to an individual that they can see, and be able to see the ball as it comes to them to receive. The fact is, this is really what many of the athletes are walking around with, and they do an amazing job with what they can. But the Special Olympics Opening Eyes program was built on 5 founding principles that would correct those kinds of issues. We believe that vision is crucial to physical, social, and academic development. People with intellectual disability are entitled to high quality eye care. We need to be able to transcend all boundaries of race, gender, religion, national origin, geography, philosophy, and politics. And we need to demonstrate how important accessing good quality eye care is. You don't have to be satisfied with someone who doesn't know how to deal with your vision problems. There are lots of people who are out there who are capable, and through the Opening Eyes program, it is our goal to provide experience and knowledge to eye care professionals to improve their knowledge of how to provide the services and increase access to eye care services for people with intellectual disabilities. So let's look at our Opening Eyes program. So the SOLCIOE is an acronym representing the Opening Eyes program. We are a partnership between Special Olympics and Lions Clubs International. So our program is really very simple. We set it up so that we could gather information that is reliable, and we don't want to spend time doing things that really are not going to give us clear information. So we start with a very brief case history. We want to know, have they had an eye exam? And if they have, when was it? And the things that we're worried about is, if it's been more than 3 years, then that tells us that they are not getting the appropriate access. If they've never had an eye exam, that is an indication that they immediately should be seen. And we never want to overestimate the information we get. So if somebody doesn't know or doesn't understand, we always check the unknown. And we just ask them very simple things. Are they having trouble seeing things far away or up close? Do they have headaches? Do lights bother them, or do they have double vision? We don't go into much more depth than this because we're going to look at the results of our tests. We want to know what they're wearing, sphere, cylinder, axis, and add. We always look to see what they're wearing and what the quality of their spectacles are. We want to know if they're scratched or broken. Many times we have athletes with incorrect prescriptions or glasses that are in terrible condition. Then we start our actual testing. The first thing we do is visual acuity. And then we chose the LEA symbols because there's good science to support the quality of the information we get. And the other thing that's more important is we can get the athletes to respond to it, whether they're verbal whether they're literate, whether they want to respond to a picture by forced choice. There are lots of ways of being able to accomplish this without relying on the athlete saying what the letter is that they're looking at. So we do this at distance and we do this at near. We also want to look at whether there's a presence of strabismus using a cover test. Very challenging in a busy environment. I'm sure all of you are well aware of the challenges associated with doing a cover test. We know that it impacts the prescription that we're going to provide for the athlete if necessary. So it's an important part of our testing sequence. We do color vision testing with the color vision made easy most of the time. Simple enough. The athlete just needs to be able to find a circle or a ball, and the athletes are testable at about the level of 98%. We look at stereopsis or depth perception using a tool that allows us to do a forced choice with something as simple as a smiley face. Then we look at autorefraction. Now, the vision in preschoolers study showed that the autorefractor that was created by Nikon is really a pretty high sensitivity and specificity, and it also gives us keratometry readings if we need them later on. We do eye keratometer. We've had many athletes, since we work with adults, that have actually demonstrated high IOPs at World Games and have been undiagnosed glaucoma patients. We look at the eye health, both the external, the internal with a non-dilated pupil, and we look at pupillary responses. This is probably the most challenging part because we know there are eye health issues that we need to be concerned about. Once the athlete goes through the program, we review the findings on each of these tests that we've done, and we decide what the athlete might need. There are many athletes that need nothing, and we'll give them a pair of sunglasses. Our sponsors have been very generous. Saflove with frames, Essilor with lenses, and Liberty with sports goggles. So if they don't need anything and they don't wear glasses, they can get a pair of sunglasses with no power. If they do, we provide an assessment of what the appropriate prescription should be. We write it and we provide it to the athlete at no cost to the athlete, based on the generosity of our sponsors. But we do remind everybody that we see that this is not a full exam. They still need to be able to go home and have a relationship with an eye care provider for continuous care. We collect the data on all of the athletes that we see. Sometimes the data is better than others, but we've been able to report that we've seen athletes ranging in age from 8 to 80 from all of the regions around the world. Most of our athletes that we see are male, 62.8%. I want to just give you some insight on 53,000 athletes that we have data on, because we've been collecting it since 2003, and I think it's really interesting to see. We've seen athletes that reported 8% had not had an eye exam in the last 3 years. 17% reportedly never had an eye exam. And I want you to know that we are not including the 34,000 athletes that could not tell us whether they've had an eye exam. The other challenges were these eye exams or were these screenings, and the athletes would not be able to discriminate that. We've been able to prove that a quarter of our athletes are seeing poorer than 20/40 entering distance acuity, and 13.4% saw vision poorer than 20/40 at near, or 3/6. Strabismus has been found to be around 10%, both at distance and near. Now, the reality is the people who come to our opening eyes programs are usually higher functioning people with intellectual disability. Oftentimes those that are not able to come to the venues may have a higher prevalence, and I'm making that assumption. It has not been proven. There was almost a quarter of the athletes who were not able to be assessed using a cover test in our venues because of the distractions. For those of you who have memories of the distribution of refractive error from early days of learning about spheres and cylinders, I wanted to show this graph. So we looked at the distribution of the spheres of our patients, and what we found was everything falls around Plano or nothing. But what's interesting is this is -5 and this is +5. We had a significant distribution of mild and moderate refractive spheres in the population that we see. I could have shown the astigmatism. We do see a higher amount of astigmatism in this population, but I thought this was much more significant. Plus, we have a lot more high-end myopes and hyperopes. We saw in our population, almost 16% had some eye health issue. Now, these are not all things we're going to do much about. Some of them are just existing or are remnants of a previous bout with an eye health issue. But some of them are things that we can make referrals for so that the athlete's vision can be improved. We saw cataracts, blepharitis, conjunctivitis of all kinds, corneal scars, pinguecula, pterygiums, arcus senilis, keratoconus, dry eye problems. We've seen lots of lid problems, various growths, scars, and lash problems, entropion, ectropion, and iris problems. Since we see many athletes with Down syndrome, it's not surprising that we saw brush field spots, as well as some aniridia. We've seen optic nerve problems that include either pallor, large cupping, collibomas, hypoplastic nerves. We've reported on a number of cases of glaucoma that have been uncontrolled. And the good thing was that when we identified it, we were able to get them into treatment, whether we were in a world game or a local game. The Lions have been very helpful in reaching out to eye care providers on the ground. We've seen many retinal lesions or scars, including macular scars, and lots of ROP. And we know that we've been able to pick up some diabetic and hypertensive retinopathy, but we have a non-dilated pupil, and oftentimes it's difficult to get a good image. When we're at a world game, we have an Optos available, but we're looking to be able to improve the tools that we have. Our goal is to really bring health to our athletes, whether it is at the local level through the Healthy Athlete program, such as our Opening Eyes, which is done at athletic events, but we're looking to bring it to the healthy communities through clinics and year-round health program. On the other level, that the national and the global level, we need to make a big change in healthcare systems, and we try to do that through working to change policies, services, and programming to increase the knowledge of our healthcare professionals through better medical school curriculum and improve funding to include people with intellectual disabilities. So our goal is to change the healthcare system to improve access to high quality eye care services for people with ID. The fact is, the Opening Eyes program has seen a quarter of the people who have not had an eye exam ever. We need to be able to find a way to improve that, ensuring everybody has access to eye care, especially with the World Report on Vision having been released last year. We also provide goggles to our athletes who play in contact sports with the idea that they should be protected, as well as any of the other sports participants. So I'd like to thank you very much for your time and listening to me. If you have any interest in finding out more about the Special Olympic Lions Club International Opening Eyes, I look forward to hearing from you. Thank you and have a wonderful World Sight Day 2020.